Welcome to the Darcy Wellness Show. Today we're going to be covering sports injuries, basically a non-surgical, non-drug approach to treatment of sports injuries. My name is Geoff Darcy. I'm an acupuncturist and herbalist at the Darcy Wellness Clinic in Natick, and with me in the studio is Dr. Pheng Kouch. Welcome, Pheng. You're a chiropractor extraordinaire. And today we're talking about sports injuries and the idea of how weekend warriors like myself create a lot of injuries, and we see in our practices at the Darcy Wellness Centre a lot of different injuries. If we could kick off with our first slide, this first slide actually shows that there are all kinds of sprains and strains that are related to sports injuries. So we've got contusions, fractures, concussions, and then there's the repetitive motion disorder with tendonitis, bursitis, stress fractures, and shin splints. So generally in your practice, Pheng, of chiropractic, you must see a lot of sports injuries. Especially with kids these days, they're under such intense pressure. They're playing sports year round. Oftentimes they're being coached intensively. So, rotator cuff injuries in baseball players, and then you have the soccer injuries with the ACL tendons. What's quite common? What are you seeing in your practice?
Sure. I see a number of different patients for a variety of different ailments, and most common things that people come in with are strains and sprains. Strains refer to the muscles, sprains refer to the ligaments. Oftentimes both are involved, and being a chiropractor, I see a lot of back and neck issues, but I also do see a lot of extremity issues, including shoulder, rotator cuff, as you were talking about, knee issues, elbow issues with tennis players and such. And the main things are, they fall into two main categories. As the last image there was showing, they fall into the traumatic and to the repetitive type of injuries. Yeah. What you were talking about earlier with children who are playing sports year-round, they're specializing, and instead of having 3 different seasons where they're playing 3 different sports, they're practicing for example, baseball all season long.
So why does that set them up more for injuries?
Sure. Well, you're not giving the structures involved the opportunity to rest and recover when you're using them all year long, and that's where you really get into the repetitive type injuries. So, for example, with a tennis player and their tennis elbow, what tennis elbow is, it's called lateral epicondylitis. It's an inflammation of the epicondyle and the structures around that area because of repetitive use in that area.
So like the inflammation sets in, and then it just gets re-exacerbated over and over by the same motion in tennis. Yeah.
So, taking a season off of playing tennis, for example, is a great way to allow those structures to recover.
Mm-hmm. So different sports have different injuries, like tennis elbow.
Golfer's elbow
is a slightly different part.
Golfer's elbow, exactly. That's called the medial epicondylitis, where you're affecting your medial epicondyle as opposed to your lateral epicondyle.
And with soccer, the injuries that are recurrent there, a lot of the ACL.
A lot of knee issues, absolutely. ACL.
Due to the cutting and the snap kicking that goes on in soccer.
ACL issues, ankle issues are very prevalent. Neck issues from heading the ball. Yeah. And surprisingly enough, a lot of low back issues from kicking and running. Right.
So the idea in your practice, how much is traumatic versus chronic? I would imagine, like with acupuncture, it's a lot more of chronic, ongoing inflammations that never you can never quite get rid of it.
Sure. In my practice in particular, I see probably 70-75% acute injuries, and the other 25% would be more the chronic type issues that you're talking about.
Right. Actually, you're seeing my daughter today with her neck injury from soccer. So that's an acute one, where you wake up in the morning and you can't move, and chances are she fell awkwardly or headed a ball awkwardly.
And then, she might have aggravated it last night, and then it really sets in while she's sleeping, and then you wake up in the morning and your neck becomes very, very stiff, for example.
Yeah. If we could go to our next slide, about the traumatic injury. So some of the advice about, you were just saying is, well, stop playing to give the body a rest. And then there's the classic RICE, which is, the rest, ice, compression, and elevation, and we'll talk about that a little bit now. And then there's more kind of conservative approaches like chiropractic, physical therapy, acupuncture, and massage, rather than cortisone shots, surgeries. There are conservative therapies that can be applied first. So if we start with, stop playing. Now, very often, if you're a committed athlete, that's the last thing you want to hear. It's
Absolutely.
very difficult. And I'm sure in my practice of acupuncture and in your practice of chiropractic, we see a lot of committed athletes. And I know I'm telling people, okay, listen, you need some rest, but the chances are, they're smiling at the other side of the face saying, yeah, okay, I'll get some rest. But they're out there hitting the tennis ball or kicking the soccer ball. That's
one of the toughest things with dealing with these athletes is getting them to stop and let their body recover. Oftentimes they'll come back too early and will re-aggravate the same area. And when that happens, almost inevitably, the second re-injury is worse than the first time.
Yeah. And also, I guess the scar tissue is building up around repetitive motions, chronic ongoing inflammations, progressing, making it more difficult for the body to heal even when they're able to rest.
Right.
Yeah,
absolutely.
So then we have the RICE, the rest, ice, compression, and elevation.
Mm-hmm.
So we already know that most of the time with committed athletes, urging them to rest fails, so then we fall back on the ice.
Sure.
So I know that you love ice. Tell us a little bit about ice.
I do. I'm a big fan, I'm a big proponent of using ice. When there's an acute injury, like most of these athletic injuries we're talking about, there's a lot of inflammation in there. The whole RICE protocol, including the R part, the rest part, is to get that inflammation out of there. So resting the area, icing the area, compressing the area to drain that inflammation, and elevating the area to, again, drain the inflammation are all parts of getting the inflammation out of that area. Anti-inflammatories are another thing that do help. Try to use those relatively sparingly, as we all know there are a lot of bad side effects that go along with taking anti-inflammatories over a long period of time.
Right. So going back to the ice, the idea of it's interesting how chiropractic differs from acupuncture. As you know, in acupuncture, we tend to, from experience, also really like ice a lot in the early stages. But oftentimes, we stray from the idea of ice, twice a day forever, until it's healed, because it will also shut down energy flow. And in traditional Chinese medicine, we have this concept of energy moving through the area. And, and I think that often how I kind of see it these days is oftentimes when there is an injury, that inflammation starts up, and its whole goal is to shut us down so that we can't re-injure, or that we, to make sure we haven't broken a limb, and just so that we can assess over the course of days. So this inflammation flares up, shuts us down. But a lot of the time it's not really involved in the healing process. It's more involved in the alarm process.
Yeah.
So icing at the initial stage, and then acupuncture really supports the use of heat with, moxibustion, which is where we burn like a herbal cigar over the area to gently warm it, or, an ice pack or some sort of warmth to get the blood and energy moving into the area, maybe get the blood moving into the tendon. And then, of course, at the end of the day, if it's become aggravated from too much use, or if you play a game of tennis and the tennis elbow flares up again, then at that point, within the next 24 hours, to use ice just to calm it down again. But we're always trying to coax in energy flow, coax in blood flow to kick off the healing process,
Sure.
Rather than it be just ongoing.
What's interesting is that from working at the Darcy Wellness Center, I've begun to tell patients to use heat more often than I was earlier on in my
because
career
physical
here.
therapy and chiropractic, right? They're very strong on.
They're very strong on the
ice. It's
and
all ice, no heat.
And as I said, seeing a lot of the results with the heat, I advise a lot of patients to use heat in some of the later stages to really get that energy flow back in that area, to get the muscles to not be so tight. When you have an acute injury, what happens is you have the inflammation, obviously, but you also have the muscles that also seize up in spasm. The ice is really good for the inflammation. The heat is better for the muscle spasm, but almost always both are present. So it's dependent on which is having the greater effect on you right now. Is it more of the inflammation that's the issue?
Let's use Elisa, my daughter's injury with the waking up with a stiff neck. She's got a big state cup game tomorrow. Now I know from my experience with acupuncture, getting the energy moving, that today she'll see you, she'll see me, she'll get treatments, and chances are with a sprain strain like that, she'll be playing tomorrow. Whereas normally without our interventions of chiropractic and acupuncture, chances are she's going to miss a very important game tomorrow. So the quickening the healing process is gauging when to use what and how to apply it will actually engage the healing process much quicker. Wouldn't you agree?
Knowing when to use.
Yeah, intervening with chiropractic and acupuncture quickens the healing process so much more.
Absolutely. I haven't seen Alyssa today yet. I'm going to see her after this. But chances are we'll be able to help her out quite a bit.
You've seen a lot of sprained necks, though.
Yeah, we do see a lot of sprained necks. Kind of the chiropractic bread and butter there. But yeah, it absolutely will hasten the healing time. What happens is when you injure yourself and you sprain, or strain rather, even a few fibers of muscles in your neck, the whole neck then seizes up to protect
like an armory.
The rest of the neck. Exactly. And oftentimes it's kind of an overreaction to it. But it will seize up and it will hurt quite a bit. What we're able to do with chiropractic and a lot of the active release techniques that I employ is to get in there and loosen up all those muscles and free up those joints to allow the body to have increased mobility in there, which will again hasten.
So it's kind of interesting that the body has this wisdom about shutting us down with inflammation, with spasm, kind of an overprotective. Okay, let's see where this goes over the next 3 or 4 or 5 days. This sprain could be something serious, or it could evaporate in 5 days. But through our interventions, we can really move that along much quicker.
Absolutely, yes.
Yeah. So we have the rest, we have the ice, and then the compression. So what does compression bring to the management of acute sports injuries?
Compression, for example, if you sprain your ankle really badly and it swells up like a balloon, you really want to compress that area as well as ice and elevate it to allow that inflammation to drain out of there. Inflammation.
So how does the compression help drain the inflammation?
It essentially pushes it out.
Yeah.
You're taking, for example, an ACE bandage and wrapping it around your ankle and elevating and allowing that inflammation to drain out of there. Yeah.
So you're kind of stopping the potential for expansion in the inflammatory process.
Exactly.
And that's kind of guiding it down and guiding it to drain away any cellular pressure that may be in the area. And then the elevation is?
The elevation is kind of what we were just talking about. Again, with the ankle, for example, is where you get that ankle up above your heart, and you're going to get that inflammation to drain towards the heart.
Yeah. So if we can go to our next slide on how to avoid injuries, so stretching them properly and warming up are two of the best techniques to avoid strain and sprain, and also listening to the body. That pain is a sign that something's wrong, not to continue on in the game if you know that you're really hurting quite badly, because it's going to take that much longer to recover from. So let's take the first one. And so stretching, Pheng, the idea of, I know a lot of athletes, and I don't know many disciplines to stretch before every tennis game, or, it's really something that athletes have to be forced to do, let alone weekend warriors who are just out there hitting the ball on the weekend, or, not many people stretch.
Yeah, people do not stretch enough. That's why you see so many injuries nowadays. The muscles in your back, in your neck, all your muscles, for example, are like rubber bands. And if those rubber bands are pulled really taut already, it doesn't take a whole lot more to then snap it.
Yeah.
If, for example, we're able to stretch those muscles out before we go.
And by snapping it,
tearing it.
Actually tearing the fibers
Absolutely.
and straining the fibers, yeah.
A muscle strain, a muscle pull, a muscle tear,
yeah.
they're all synonymous. They're all the same exact thing.
Yeah.
They just have slightly different connotations with regards to how bad the injury actually is.
Yeah.
But yeah, you will literally tear muscle fibers, and stretching before activity will increase the elasticity and flexibility of those muscles so that you're less prone to injury.
So it's also fair to say that it's not just about stretching out the muscles, to avoid an injury during the next game, but it's also about the idea of stretching to avoid weak spots that may show up. So, for instance, the hamstrings. If you're playing a lot of competitive sports and you have tight hamstrings, that's going to set you up for lower back problems, right? The idea that the mechanics of the body are aggravated by constant motion. So how do, say, for instance, tight hamstrings affect the lower back?
Sure. Tight hamstrings is a very big issue with a lot of athletes. What happens is if the hamstrings are tight and there's no flexibility in your hamstrings, and you bend over to pick something up and that flexibility isn't in your hamstrings, it has to come from somewhere.
Right.
So oftentimes what happens is you overstress your back, and that's when you end up straining your back muscles.
Right.
So getting that flexibility in your hamstrings will kind of take a lot of the pressure off of the other structures in the area.
So you've got more give, therefore the strain doesn't go through to the bones, to the actual structure
exactly.
of the spine
Less
itself.
stress is being put on individual structures as it's being kind of, distributed throughout your hamstrings, your glutes, your low back, as opposed to just to your low back.
So in that instance, stretching as a regular routine of the hamstrings is something that will protect you in the next couple of years, because if you have tight hamstrings, chances are in the next couple of years, no matter what you play, you're heading for some sort of sprain strain of the lower back, right?
Most likely, yeah.
Yeah. And how about the stomach muscles? The other idea that weak stomach muscles will also set us up.
So, for example, if you have a weak core, which is kind of what we're talking about, you're talking about the stomach in particular, but when we talk about the core, we're talking about the muscles in the low back as well as in the stomach. If your muscles in your stomach are weak, the core is kind of like a big barrel that encompasses your body here, and weakness in any part of that area, whether it be in the front, in the abs, whether it be in the back, in your erector spinae muscles or your oblique muscles, for example. If there's weakness in any of those muscles, your whole core isn't solid and strong. And you're putting additional pressures on your back.
So you're not able to absorb stresses. They go straight through into the lower back.
More or less, yeah.
So the idea of the myofascia, right? So the myofascia is tissue that links, say, tendons and ligaments to bones. Kind of almost like when you pull bone away in chicken, you see that stringy kind of connective tissue. So the myofascia being strong helps to protect us against injury. And the idea of that is, if you're getting hit suddenly without knowing it from the side or from behind, the stress goes immediately through to the structure because there's no protection from the myofascia or the muscle system. So working to keep the myofascia strong is a very strong protective capacity to stop us getting injured from sudden hit in soccer or in football. So strengthening the myofascia, strengthening muscles.
Yeah, absolutely. Strengthening the core, strengthening your lower abs, strengthening all the back extensor muscles, your obliques, will help to, just in general, give you more protection for a lot of the injuries that people sustain.
Okay, so if we could go to our next slide, and maybe you could tell us a little bit about, the application of chiropractic. So chiropractic is effective in treating sprains and strains of ligaments and muscles, and there's an interesting study in 2010 study of, Aussie, actually it's rugby, football players, kind of a form of rugby, Very tough game. Chiropractic therapy led to a significant reductions in lower limb strain injuries, and the time missed as a result of knee injuries was much lower and reduced the lower back pain. So it was quite a large study that showed that they were able to reduce the amount of injuries with chiropractic, and they were able to reduce the amount of low back pain. So again, chiropractic, through working with the muscular, not just about working with the bones, it's also about working with the musculature and how it applies to the balance of the bones.
It is. The bones and ligaments and muscles all play a huge role in stabilizing your entire body, and working on just one of the facets, for example, just adjusting the spine, for example, certainly is effective. Similarly, just working on the muscles is, again, relatively effective. But when you add working on all of them, that's where you really see leaps and bounds of improvement.
Right. And so we've been talking about injury, but it's really also about performance. So if you can identify a weakness in the structure, like, say, hamstrings are tight, then you can set exercises for that athlete. That athlete's going to become more effective because he has a more effective structure. He's no longer tight in a certain area that's hindering certain motions of his body, so he can run faster or cut quicker. So the idea of performance and enhancing performance in young athletes or competitive athletes, that's something that chiropractic does very well.
Sure. Going along with that example, with tight hamstrings, the hamstrings are attached to the bottom part of the pelvis, and oftentimes if there's tight hamstrings, certainly the person won't be able to run as fast, for example. So by working on adjusting the pelvis and stretching out the hamstrings, you can get a person to, run a 40 and that much quicker, for example. Right.
So the idea of regular tune-ups, coming to see you to get regular chiropractic is to keep the structure in balance. Like I know my daughter, we get her in to see you, get her in to see, preventative acupuncture. It's a way of keeping the body in the best efficiency for best performance.
Yes, absolutely.
So if we could go to our next slide, because a lot of our top athletes right now are already using a lot of chiropractic, and Tiger Woods states that lifting weights and seeing a chiropractor on a regular basis has made him a better golfer. I mean, that's a direct quote from Tiger. And if we could go to our next slide, which is a big advertisement for chiropractic right there. Get adjusted. I've been going to a chiropractor for a long time, as long as I can remember, and it's important for me, for my training, as practicing my swing. That's Tiger getting adjusted. Maybe she'd get adjusted with his addiction. He's already got an adjustment there, not a chiropractic one, but still, that's quite an endorsement from the top golfer in the world that it's increased his performance. And if we could go to our following slide, again, we see some other top athletes. Arnold Schwarzenegger has been a huge supporter of chiropractic, and Bill Romanowski also. His opponents are not thrilled at his good health. Romanowski is considered to be one of the dirtiest players in the NFL, a linebacker. But and then our next slide we also have with Lance Armstrong, 7-time Tour de France winner. I mean, that's quite an achievement, even with his struggles with cancer. All these top athletes are really endorsing keeping their structure in balance, keeping their musculature in balance with chiropractic. And some of them actually with acupuncture now. There's Team Adidas has an acupuncturist, and we know that Daisuke also has an acupuncturist on staff in Boston that he brought with him from Japan. So these people find, the top athletes have found their way to keep themselves well tuned. So what would you say to an athlete who says, I don't really have any injury at the moment, why should I get acupuncture? Why should I see a chiropractor?
One of the slides that we were talking about before, that we had on earlier, talking about pain and stopping when we feel pain. Pain is a very interesting thing. Pain is one of the last things that people actually feel. So people don't usually feel the tightness unless they're acutely, keenly aware of their self and their body. But most of the time, a young athlete, it's not gonna feel that tightness in their hamstrings
because they're not clued. They don't have the awareness of their body.
Exactly. Yeah. They don't notice that their low back is tight or that their neck doesn't really move that freely. They only notice it when it hurts. So getting things addressed before they're hurt,
before the alarm bells go off. So there's a lot of subtler signs that could lead them in to head that off at the pass, or they don't necessarily get the pain.
Exactly. For example, range of motion. A young athlete should be able to turn their neck pretty much 90 degrees in either way. If you're not able to do that, you might be having some issues going on. You might have headaches, which would be another example of something that might be going on with the neck that doesn't manifest itself as neck pain, but you have headaches. So often that is an issue with the neck, and addressing that will resolve the headaches, for example.
So, and if you are finely tuned in the way you've trained your body too, I mean, the training should go a little bit further into developing awareness of subtler signs in the body, because we know that, for instance, even if you have some tightness in the knee, not even a major thing, for tennis, that will throw off all the motions of tennis. It will throw off a great deal of the motions of soccer, and definitely won't be jumping as well in basketball. So the idea of, even small hindrances affecting the entire structure, in fact, affecting, very fine-tuned motions like shooting a basket or, doing topspin, serve, they're all affected by. So the idea that everything is impacted by everything in terms of the musculoskeletal structure.
Sure. The body is one large kinematic chain. And
kinematic chain, that was the word I was looking for.
Kinematic
if I'd have known it.
The whole body is one big kinematic chain, and something wrong with your big toe will affect your ankle, which will then affect your knee, which will then affect your low back and your hips, and carry on.
And that's all about affecting performance. If we could go to our next slide. So the idea of the best athletes in the world using chiropractic in acupuncture to give themselves competitive advantage, and we've known that in our practice, handling injuries, getting someone back into competition quicker, getting them out of injury quicker with chiropractic and with acupuncture is extremely effective, and also using herbal medicines, because we know, in conclusion, we know that non-steroidal anti-inflammatories really impact, the gut lining, the lining of the stomach. It depletes the good bacteria. There are 16,500 deaths each year attributed to non-steroidal anti-inflammatories. So if you have chance to use a herbal anti-inflammatory, or if you have chance to use magnesium to help the body, the muscles relax better, that's a much more sensible approach first. And the idea of using chiropractic and acupuncture rather than considering injections of steroids to handle inflammation are ways of managing recovery and managing injury that are make a lot more sense to me.
Absolutely.
So, Dr. Kouch, I'd like to thank you very much, Doctor of Chiropractic at the Darcy Wellness Centre. Thanks very much for joining me today on our show on sports injuries. My name is Geoff Darcy. I'm director of the Darcy Wellness Clinic, acupuncturist and herbalist. And thank you very much for joining us today. Thank you.